Okay, esteemed members, good evening. Thank you so much for joining today's session. If you can hear me, just send a message on the chat and let us know which PSK branch you're joining us from. If you can hear me, just let us know which branch you're joining us from. All right, thank you. I see some responses. Thank you, Dr. Vincent from Central Rift, Dr. Francis from Nairobi, Karibu, Dr. Tawakal from Nairobi branch, Karibu, Dr. Tracy Andrew from Tana Athi, Dr. Janet Omambia from South Nyanza, welcome. From Mount Kenya, Dr. Bedan, welcome. From Central Rift, Dr. Esther Mimano, welcome. Dr. Werimu Mbogo from Kiambu, Karibu. Dr. Abdirahman from Mandera, welcome. So we have members from Western Branch, Dr. Elizabeth and Dr. Nicholas Baraza, welcome. Dr. Chaher Mohammed Ahmed from Comoros, Karibu. Dr. John Makori from Nairobi Branch, Karibu. If you've not had your branch, maybe you could represent it by sending something on the chat. From Coast Branch, Dr. Daniel, welcome, thank you. Dr. Keter from North Rift, you're welcome. So members, as we wait for other colleagues to join, I'd like to ask you to kindly go to the PPB portal and subscribe to this event. This is the last session for the 3-series webinar that we've been having. And all the events are on the portal. So kindly just go to the PPB portal and search for the word KNPP. That should be able to help you to find the event. And once you find it, ensure you sign up or subscribe to the 3 events that are listed there. For those who've just joined, we are subscribing to the event on the PPB portal. Use the search keyword KNPP and you should be able to get the event quick on the PPB portal. Right, so I think we'll get started. For your colleagues who've not joined, you can kindly just send them a message in your branch WhatsApp group so that they can join us. So once again, thank you for joining us. This is our last session of the three webinar series that we've had on dissemination of Kenya National Pharmaceutical Policy, Evaluation Report, and preparation for submission towards policy review. And this session will be on preparing to revise the KNPP and identifying the key considerations. So for this session, we'll be having 3 speakers. We have Dr. Menge, who's the head directorate of HPTs, MOH. We also have Dr. Nancy Njeru, who's the head division of HPTs, Management and Therapeutics at MOH. And finally, Dr. Susan Jogo, who's the technical advisor for the Africa Resource Center. So just a few ground rules before we start. Just to remind you that you'll be muted during the entire course of this session. So if you have any questions, I'd encourage that you use the Q&A tab so that you'll be able to track the questions easily. And if you haven't again, kindly ensure that you subscribe to this event on the PPB portal. Remember, there are 3 events, so ensure that you subscribe to each of them using the keyword KNPP. So for the program for this evening, we'll be having some remarks from Dr. Tom Menge, and then a presentation by Dr. Nancy Njeru. Then we'll be going through the submission form that we'll be using to submit our feedback of the KNPP, and it will be taken through by Dr. Susan Jogo, and then we'll have a short Q&A session by Dr. Susan and Dr. Nancy, and then a wrap-up and call for submissions by Dr. Tom Menge. Then thereafter, we'll have just a parting shot from each of the panelists. So I think at this point, I'd like to welcome Dr. Nancy. I see Dr. Tom is yet to join. So maybe I think you could start us off for the evening.
Okay, thank you very much, Hezron, for the introduction. I'm Dr. Nancy Njeru. I work at the Ministry of Health, Directorate of HPT, and I'm glad to join you in this session number 3. I can see we have not yet been joined by our director, and so you allow me that we skip the remarks, the opening remarks. We get into the presentation, and if he joins us in the course of the presentation or in between, we'll give him an opportunity to say hi to us all. So I'm going to project the presentation and kindly confirm that you can see something. Someone confirm that you can see something?
Nancy, we can see.
Yes, we can.
Thank you. In case my voice goes away during the session, you remind me. And good evening again, colleagues. It's really a great moment. We are coming to the end of these sessions. And we are also glad that we all have an opportunity to shape going forward the policy and regulatory environment that we work in by participating in this process. So it's a great opportunity for us to be able to even be part of the revision of the KNPP to what we want to see in the future. I'm trying to move forward. Thank you. So today's session, this presentation is very short. It's going to be around 12 slides, and it's more around a recap or a recap of what we have been able to look through in the previous sessions and requesting for submissions from yourselves. So basically everything is more of a recap. And for those who've not been able to join us from session 1 and session 2, it's important that we just remind ourselves of the objectives of this dissemination, why we are disseminating the evaluation report of the KNPP. First is to appraise all of us, the participants, of the implementation status, which was done in depth last session by our director, Dr. Tom Menge. Number 2, we didn't want to engage with you on the challenges facing the sector, even as we sensitize and we receive policy submissions from you. And today we'll have more of engagement session because the presentations are short. We also want to sensitize participants on the policy making process. This was part of the session 1. And if you want to get more of the details, you can read the evaluation report. It has a whole section dedicated to the policy making process. And finally, number 4 is our big goal in this dissemination, that we can be able to receive policy issues and problems that are affecting the HPT sector or the area of pharmaceuticals, so that we are able to comprehensively handle them in the next policy. So this slide is just to show us where we are. The area session 1 and 2 have been covered, and today we are dealing with session 3, that is preparing to revise the policy. So I'll go direct to a summary of the policy making process, like we saw in session 1, or the number 1 to number 8, the policy formulation process and the key steps that we need to go through. And I want to go through them in the next slide. As you can see, the key steps number 1 to 8, we are preparing for number 1, 2, and 3, that are the technical areas that us as DHPT, we are supposed to lead and ensure that we are engaging all stakeholders in this process. First is to identify the problem, which we'll be requesting you to identify through a form. And in this area, we'll be having some, we are supposed to engage widely and get comprehensive and comparative issues on the policy. What are the challenges? And then we move now to the agenda setting, where we'll be debating and negotiating. Of course, when you propose a certain policy solution or action, it has an impact on someone else or another stakeholder in the sector, and there will be that pull and push until we are able to reach a certain area, or you are proposing something and maybe it has a conflict with another law or something like that. So those are some, or it's not aligned to the sector priorities. And when it is okay, of course, it goes through. So that is a very critical process that you'll be going through. And even when we make submissions, perhaps not all the submissions will go through because of some of these aspects of negotiating and debating around it. So you'll find that maybe not everything will get into the policy document. And then finally, now we'll draft the policy with the issues that have been agreed upon by the sector stakeholders. And if you look beyond there, those other processes are not directly in our control. One of them is the Cabinet or County Executive Committee. This is where we submit the policy for Cabinet approval. And proper analysis must have been conducted where different approaches or different alternatives to solving the problem must have been evaluated completely, so that the policy only provides the best option available to address the situation. So that will be very core when we be submitting. And again, the issue of fiscal, constitutional, or other policy implications must be very well addressed by every policy action that is proposed. The next step, which is step number 5, is about the parliamentary or county assembly approval. We are mentioning both because these steps happen both at the national level or at the county level, depending on who is doing a certain policy. And in this area now, the policy is debated and may be approved with or without amendments. And the views, of course, of the executive may be sought for value addition. And it's very important to seek them even way before. Like now, our minister is aware that we are reviewing the policy and we have the support. It's only now the details of it that we'll have to keep appraising the leadership as we progress. The next one, number 6, is assent, where now the policy is, if it's passed, the speaker now submits the approved policy to the president or the governor at the county level for endorsement and the fixing of the national or county seal. Once that happens, it now goes to publication. That is step number 7. And let me read through. Upon assent, the policy is published as a white paper, a statement of intent, and a detailed policy plan, which often forms the basis of legislations. The executive is expected to widely circulate the policy and keep the public informed. So that will be step number 7. Finally, we will have now the drafting of the bills. Just to take you back a little on session 1, when we were debating that the KNPP was the issue of self-executing and not self-executing. And when the policy has a lot of maybe institutions, agencies to implement certain processes, and it proposes even legislation, how they are governed. Like now they start saying a certain institution be brought on board, like the professional council. It will require now starting to draft bills to put that in place. And that is step number 8, which is after the policy has been put in place. So the policy addresses all the sector issues. And finally, is implementation and monitoring. And that section of monitoring and evaluation is in green because it's just what we have done on the KNPP. And again, we go back again to problem identification. So it's important that we understand where we are, where we have control, and where we can chip in as members. With that summary wrap-up of the policy-making process, allow me then also to just try in a very simple way to wrap up the issues in the KNPP so that we bring them fresh to our mind. I'll try my best. It's not easy to really consolidate such a document into just a few ones because it's really broad. But just broadly speaking, that policy was addressing the issue, number one, of disease burden, the unmet need for essential medicines and medical supplies, which is our core as a profession in pharmacy, and the aspect of access challenges were addressed comprehensively in different ways, and access can be either in terms of the actual availability of products, it's either in Kenya, registered in Kenya or not, it's either we are manufacturing it or it's available for people to use. There's the issue of geographical access, there are issues of affordability, which was really also addressed very well, and that's the financial access, aspects of acceptability, etc. So that is generally just the issue around access to meet the need and address our disease burden. The other broad area that the policy trying to address is the issue of institutions. And if you remember us going through the challenges and issues around strengthening the pharmacy and poisons bond, the issue of PPB versus KFDA, again, we talked about the leadership at the Ministry of Health, the Directorate of Medical Services, how that affected governance, the issue of institutional and legal framework for public procurement, again, issues of KEMSA, NQCL, Pharmacy Practice Council around the personnel regulation. And generally in that area, we could wrap up the issues of weak mandates across the institutions, either conflicting with the other regulatory bodies or overlapping or weak, or they are not fine, the regulatory system are not well funded. The other issue we can summarize the issue of people. Again, the training institutions for pharmaceutical personnel, the need, the persons being trained, meeting the market need. Do we have enough numbers, skills, specialties, including recognition? If you remember, effective deployment, the schemes of service that we are going through, issues of motivation, and just wrapping up that area is a broad aspect of remittent HR capacities. The other area we saw in the policy as issues then in 2012 were issues around industry capacities, starting from local production and capacity growth, issues of size, scope, capacity, and even how well we take in the intellectual property protection rights that we've been given versus exploitation of the public good for public good and protection of intellectual property. Again, we saw matters of complexities of pharmaceutical trade addressed, trade liberalization and information management, and even the health supply chain. So basically, when you look at the whole value chain from industry to the point of use, we could summarize that in terms of weak value chain that the policy was trying to address. Another area in terms of summary is aspects of collaborations, either at local, regional, or global level, and international dimension of pharmaceutical trade that you have to have a lot of collaborations and bilateral engagements, and how well we are prepared in that area, even at SMOH. Aspects of alignment with key policies and international commitments. Today we are talking about SDGs. Then there were aspects of the Millennium Development Goals. Today's strategic development goals. The aspect of international health partnerships and global financing, I think that came around, it was around the time a lot of funding was coming from partnership to support HIV and other strategic programs. And if you look at the policy keenly, if you have read, it was speaking to issues of undisclosed budgets, budget line where you are not able to know what is funded at what level, and that bringing together that information together. And then there are issues of collaborations along ministries. We know we have Ministry of Trade, we have National Treasury, very critical in terms of the pharmaceutical sector, and other players that we are engaging. So the ministries, departments, and agencies, including the private sector, If you remember, even the aspect where it was addressing issues of pooled procurement. So broadly speaking, we could say challenges around the coordination of actors, both at the global, regional, or locally. The last one that the policy was trying, mainly this one is more like bringing in around the emerging issues or the context within which the 2012 policy was done, was the issues like globally changing legislative environment. And if you look around, many countries were trying to adopt FDAs, and Kenya was not left behind in that policy. The new constitution was just put in place in 2012, and there was a lot of trying to align. Again, devolution of health services was happening, and we also how it affected the Directorate of Health of Pharmaceutical Services, when the pharmacy services were devolved almost completely in 2013. And then there was Vision 2030 that has just been put in place around 2008. The health policy review, we all know the health policy is 2014-2030. There's even a version 2012-2030. Perhaps that one waited for the devolution to first happen before it was completed. Technological advancement issues, and again, the evolution of pharmaceutical care. So that aspect of, again, flexibility and adaptability of systems, and even the policies move forward, will be very critical. Moving forward, my last slide is what is our focus now moving forward. And I felt if we address these three issues, I don't know whether I've summarized them well. If we address these three issues in the policy, will really have done justice. One of them is to ensure there's timely access to medicines and HPT that Kenyans need at a cost that individuals and the community can afford. We know that if you unpackage that statement, it can bring a lot of issues that we need to address. The other one is that the medicines, products and technologies meet appropriate standards of quality, safety, and efficacy. Again, very critical. And finally, maintaining a responsible and viable industry or value chain, which we know it's where we play in. And those are the things we need even to focus in the next policy. Now, what will be an important thing for our discussion today is what are the issues now, and how do we handle them moving forward now that we've been given this great opportunity. And at this moment, I would like to welcome Dr. Susan Njogo to take us through the submission process and the template. And thank you very much for listening to me. I don't know whether there will be question in between, but Hezron, maybe you can tell us. Otherwise, at this moment, mine was brief. I'll just welcome Susan.
Thank you very much, Nancy. Good evening, colleagues. Nancy, so allow me to share my screen. Yeah, so good evening, colleagues. So as Nancy has clearly introduced, we are at a stage where the evaluation has taken place. Maybe the panelists, you can confirm that I'm audible?
Yes, you are.
Okay, thank you very much. So we are at a stage where we have done an evaluation, and when you do an evaluation, then you go back to problem identification, but you'll also find that based on the question that we are asking, we are also asking whether do we need to revise, or do we think that the KNPP is still adequate and can push us maybe for a few more years. So for this template, it's a Google form, and we have 4 sections. Section A is the introduction, and we also have a section on the policy, the submission guide. Then we have stakeholders details, and we have the questions. So I just put dummy data in this so that we can be able to align. So here, allow me to put my email. So that's the first thing you do, and you'll actually also find that most of the areas are actually mandatory. So we have this introduction that the Ministry of Health through the DHPT is considering. the revision of KNPP to support the process, the engagement of stakeholders, and all of us here are stakeholders in problem identification, which is key in supporting the agenda setting. This is a call for stakeholders to submit the prevailing issues on HPTs. So the reason why we are putting as HPTs is because there have been a lot of discussions that we also need, there may be specific issues to nutrition, to diagnostics, to medical devices. So maybe here we'll, as members, will be maybe more, we look more on the medicine, but I know that there are also some pharmacists who are in medical devices and other areas. So for each problem that you actually submit, it would be good that you provide reference materials, which you can send directly to the email provided. And for any clarification, then you reach out to Dr. Nancy Njeru, and the email and the phone number are there. So this is the guide, which again, you will read, is just giving us just a bit of information about public policy making. I know we have had the presentation, but remember, not everybody has been attending. So we thought it is very good just to have this preamble about public policy. I don't have to read all the points. And here we are being encouraged to submit either as individuals, or we can do it jointly, and very important to ensure that we are comprehensive about the problem, because if your problem is not understood, then it will not even form part of the agenda setting. So we are being encouraged to be as comprehensive as possible, but also we can do that in a very concise way. So if I go to the next, this is where we fill our details. So if you're submitting as one person, you can fill your name. If you're submitting as many people, keep adding them. Maybe here I'll put John. This is dummy data, so if there's a John or Cheng here, don't feel offended. Put your organization. Let's say you have an organization, TOCA, something. Yeah, so you'll put that, then put the phone number for the organization. If you're an individual, then you'll put your number. So allow me just to put some dummy data, because you can see where there is a star, this red star, then it is mandatory. If you don't fill, it will keep bringing you back, telling you that you've not filled. Here, we are thinking that you can put your address, and then here you come and tick whether you are doing as an individual, as an organization, as an organized group. So here, as an organization, maybe assume that as PSK or as a branch of PSK, you decide to come together. So you'll do that as an organized, but also we can be 10 individuals, and we say, let us discuss, brainstorm about the issues, and we do that. Like maybe the interns can be able to come here and say that let's submit our issues as interns. So they'll again come here, and any other, then you can be able to tick that as and fill. So allow me to feel that this is an organization. Then here you say which sector are you coming from? So I'll say I'm from private sector, and then I'll go to next. So this is, now we come to section D on the questions. And the first question is asking, from the evaluation of KNPP 2012, the policy was found to be forward-looking, and most of the issues and interventions provided in the policy still relevant today. Based on the evaluation finding, do you think we need to revise, update the policy? So again, I'm assuming that all of us were able to get the report and go through it. And here you can either, if you feel yes, it will take you to question 2. So again, the form has the skip pattern. So if I feel yes, it will take me to the relevant questions. If I feel no, again, it will take me to the relevant question. Let me say yes first. And when I say yes, it comes to question 2. Allow me to go back. so that we see the no option. If I do the no option, you can see that it has skipped question 2 and taken me to question 3. So depending on the question, if you answer yes, the yes or no question, if you answer no, it was yes, it was skip the questions that are related to no and the vice versa. So let me go back and so that we can be able to, because the yes has almost all the questions. So I do yes. And for yes, then I must kindly identify the problem, issue, or gap that is in the pharmaceutical sector or diagnostic sector, medical supply sector, depending on which sector you are in, and describe them as per the details below. Provide citations and references where applicable. So question A is what is or are the problems? So again, I believe that you have a KNPP, you will be able to get the issues that had been identified and tell us whether those issues still prevail or some of them have been solved. We have emerging issues that need to be considered. So that's what we expect from you. So, and here you can list as many issues as possible. You can come and say one. You type your issue. You have your two. You type your issue. So even if you have 10, keep typing the issues. Then when you come here, B asks, where does the problem exist? And we are saying that align your response to question 2A. So whatever problem here I said is 1, when I come here and I say 1, then I'll be answering where does the problem exist with relation to question 2A1. Yeah. So again, you'll fill it. And then for question 2, then you come and say where it exists. And what does it mean about where it exists? There are various sectors. You may say that it is in the public sector, it is in manufacturing, it is in academia. Maybe our training has a problem, regulation. So you have to mention that problem relates to which area. Then we come to number C, who or what is affected. Yeah. So we have to say maybe the end users are the ones who are affected by problem A, or it is our training institutions, or it is our regulator, or it is our manufacturing sector. So again, tell us who or what is affected. You clearly describe that. And again, remember to align that so that from A, we'll be able to, whatever is A, then we'll know that you're answering for that particular, your response as per the problems you have identified. Then how did it develop? So here we are expecting a description. You explain to us if you have the history of how the problem came about. Assume right now we are talking about maybe what is very common about quacks in the pharmaceutical industry, in the community pharmacy. How did they come? You know, maybe we're already saying that we have a lot of drugs that are coming and they are affecting quality. They are not coming through the right way. So give us a history if at all you have it. I know most of us, if you're in that area, you'll be able to know exactly how the problem came. So again, tell us how that problem came. What are the major causes? So for your problem 1, again, tell us the cause of the problem. You may think that number D and E are related. Yes, they are related. So see how much you can be able to describe the causes. Remember in question D, you are telling us, like, describing how you think that problem generated and what caused it, because it's like you're doing a root cause analysis. Because with a root cause analysis, then it becomes easier for us to justify that this is actually a problem that requires a public policy, and that's why we need to include it. Remember, when you're doing public participation, you have to give a lot of justification of why that problem requires a policy action. Then what are the proposed solutions? So again, give us your proposed solution for your problem 1 and problem 2. So remember, even if you have 10 problems, keep listing them. Then how might the costs be affected by policy action? In short, what impact or outcome do we expect by having a policy action? Maybe we'll improve access. Yeah, maybe if we say that let us see what we can do to our local manufacturing so that most of the products that we are manufacturing, as an example, we are sourcing them locally. And with that, we are assured of lower price. And also we are cushioning ourselves from the issues that came during COVID, where we could not even import product. So explain clearly how the problem you identified will lead to an impact or an outcome. Then here is the problem covered in any policy, act of parliament, regulation, or enforceable guidelines. And again, when you talk about enforceable guidelines, we are not just talking about any guideline. Enforceable guidelines mean that a guideline has been taken to parliament and it has been discussed, and therefore it is enforceable. So we actually have enforceable guidelines. So it's not just any guideline. So the reason we're asking this question is because maybe the issues that you have identified, maybe there is in another policy, like maybe the Health Act, or they are in an act of parliament or in a regulation, but maybe you feel it is not covered in the best way, and you think that by it being done in a different way, then it will have an impact. Then you tell us how much it agrees or it conflicts with maybe what you think. So again, give us your answer there, and you can go to the next. So remember, we are now following the yes option. So that's why we've come from number 2 to 4, because number 3 was if it is a no. So we'll go back so that we are so able to see that path. So on implementation of the policy, explain how the government, the professional associations, and any other relevant stakeholder would make a tangible contribution to address the issue. So again, you can say the government, what do they need to do to implement right now? For example, the agenda of local manufacturing, and you find that you have to work with other ministries, you have other government departments and agencies. If you're able to list them and what each is expected to do to bring an impact, then list them and describe what is expected from them. So again, ensure that you put that. Then number 5, KNPP assumes that the policy issues and interventions included were applicable to other categories of health products and technologies. So actually, this is a statement that is just lifted from KNPP itself. So please, if you read the policy, you'll see that. So here, what we are asking is, in your best assessment, is this true? Yeah, can we say that the issues that affect the pharmaceutical sector or medicine sector also apply to diagnostics, to medical devices, to nutrition? So again, in your best assessment, assuming you say yes, what happens? So it tells you to submit. If you say no, okay. So if you say no, then what does it tell you? Yeah, you see there is a question. It asks you, if not, do we expand the policy to include all health products and technologies, or have different policy documents for the different categories? Okay. I know we did this question, but already I've noted a problem, because these are 2 different questions, because you'll be answering. So you may need to separate that so that you are either responding to the first part or you are responding to the second part. So, and also we'll be getting your inputs in terms of what additions or deletions or amendments we need to make to the form. So assuming I say yes, then it takes me to submission. And if I say no, again, it takes me to submission. So allow me to clear the form so that we also take the other path of, or if I go, the other path of no. So I'll clear the
Just
form.
go back. Don't
Oh,
clear it,
sorry.
just go back. Yes.
It's okay, I've already cleared. So allow me to quickly do this. I'll just put so that we are faster. So I'm doing as an individual. Then here I'm in academia. I go next. And here I say no. Yeah. So once I say no, then I go to question 3 that asks, if no, revisions updating of KNPP is required, are there implementation challenges that you'd like to highlight? Which ones? Then here, you actually describe them, because it means that what you're proposing is that the KNPP is good as it is, but maybe we need to make some improvements in terms of implementation. So you describe that. And then you go next. So when you go next, then it takes you now back to question 4. And then you're able to fill all the, whatever we have filled when we said yes. To the best, let me, so if I say yes, it takes me back to submission. If I say no, again, it asks me this question. So you can actually say that simple. That's the end of the presentation. And if you have any question, please put it in the question section so that we are able to answer. Back to you, Nancy.
Okay, thank you, Susan. Asante sana. I'm looking for Dr. Menge. I'm not able to see our director today. So we'll continue in case of any questions. But I can see that other members of the Directorate of HPT are in, and I'm not able to see them by name. Who is in from DHPT? Hello?
Hello.
Yes,
Hi there.
good evening.
Good evening. Good evening.
Karibu sana members of DHPT who are in. Karibu, Dr. Eunice, karibu. So we are basically accepting any questions that are coming in, and also requesting that members really commit to submission of issues for this process, the review. It's really a very critical moment for us to be able to really submit to what will be the next policy. We are only speaking because there are no question and answer. But basically, this is your session. We made it short from our side so that we can engage more. Good evening, Keva. You want to say hi? Karibu. So members, today is your session, Lily. Any questions on the form? Any improvements? Yes, welcome.
I'm seeing there's
Yes.
a question from Dr. Wangai who's asking what are the deadlines for submission?
Thank you for that question. We are hoping that we can give members 1 full month up to the end of October to be able to make the submissions. But we can also discuss, because there are other stakeholders that we are continuing to engage on. But by end of October, I think that is good. One full month.
All right, I see another one from Dr. Geoffrey Kome, who says, hello team, thank you for the series of sessions. Kindly take us through the policy development process once more. So I don't know if you can guide on that, Dr. Nancy.
Thank you. And thank you for that, because it's very critical about the policy making process. Maybe just an agreement with the participants, if we can go back, because I know we are almost 400 members, and that's a suggestion of one. It's important, but if the members agree, we'll be able to take you through it again. And through consensus, if we agree to go through it. To you, Munyakin, to help us get that consensus, but we are available and ready to do that.
Okay. Maybe for those who would like to hear it again, you could maybe raise your hand. So I see a couple of hands are coming up. Yeah. Yeah, I think we have over 10 people right now. Oh, it's actually 8. Yeah. Though some people are already lowering.
So what's the verdict, Munyakin? Ezra?
So I still see there are a couple of people who would wish if you could take them through once more the policy development process. Maybe you can just maybe give a summary.
Okay, maybe I can do that quickly.
Yeah. And meanwhile, I see there's Dr. Dorothy who's asking for the existing guidelines related to the 2012 policy. So I think we'll just share the link to the existing policy that you had already shared with us.
Share both the policy and the evaluation report.
Okay.
Okay.
All right, Dr. Dorothy, I'm going to share that in the chat in a moment. Meanwhile, you can keep your questions coming as Dr. Nancy prepares.
Yeah, I'm ready.
Okay.
So
okay.
I'll go direct to session 1 and take us quickly through the policy making process that we described in depth in session 1. And here are the slides. There are a few of them. So looking at the introduction to policy making process, we asked several questions that are supposed to be answered when somebody is starting to make the policy. One of them is what is a public policy? It's very important to understand it, because when you talk about policies, of course, you know, there are strategies, there are guidelines, there are registrations, regulations. And so it's very important for somebody to understand what are some of the issues I can address in the policy or in a strategy or in a guideline. So that is important. The other question is who makes public policies? The context of public policy making process. Why is a public policy needed? The types of public policies, the key stages, like we've just seen in this last slide session we've done today, and the procedures of passing the bills. So we say that a policy is a document even somebody can do in your own house, and you give policies and rules that need to be followed. They also happen in our private institutions and corporates. And so a policy is a purposeful statement, written or spoken and aimed at solving specific problems. You can have a policy in form of a circular or a declaration. For instance, if the president declares something, it automatically becomes a policy. It does not have to be written. But most importantly is now looking at what is a public policy, because that is different from any other policy. And so this is also, again, a purposive statement and consistent course of action produced and pursued by the government. That's where the difference comes in. A public policy must be made by the government, It must be as a response to a perceived problem of a sector or a constituency, and is formulated by a specific political process. Today, if you Google, you'll find guidelines for policy making in Kenya, the steps you are supposed to go through. And it's adopted and implemented and enforced by a public agency. For instance, a policy will either be enforced by the Ministry of Health, either through the different sagas, like we see PPB, we are able to see other enforcement bodies, or either they are implementing or enforcing it. So with that, these are the attributes of a public policy. It needs to be purposive and goal-oriented. It is a product of demand. There's that demand, especially from us as stakeholders, from the people who are pressed by the problem. And it has presupposed a theory of change. Remember when Susan was presenting, where you have to show the root cause and how the proposed solution will bring the change. You know, that theory of change must be very clear to the policymakers, even as you sell the ideas to them. It provides the guidelines for action, and it's made by the public authorities on public's behalf. We are a Ministry of Health, and we make public policies on behalf of the government. We are now we are doing UHC and the SHA chief, and it's being made on behalf of the public. So the other thing we looked at is the stakeholders in public policy making process. And we are very keen to see ourselves. You can see there are citizens, there's the media, there's academia and research institutions, there's organized groups such as professional bodies, NGOs and foundations and communities, international institutions, national and county governments, cabinet, and parliament. And all these stakeholders have a lot of interest in the policy-making process, and you have to think through what their interest would be or what would they want to see, so that your issue sails through. How do you see that it impacts them? Either if it really affects them, you have to really engage them more and see how you can win them or influence them. The other aspect we looked at is the context of public policy process and the interrelationships. When we were looking at number 1 to 8, it looked almost very linear. And you can see behind these many lines, behind there is the issue of the problem identification, agenda setting, policy design, policy implementation, and evaluation. But within that, there's a lot of context. There's the global context. For instance, if you look at the how we have embraced UHC, there's a lot of UHC agenda globally that has really influenced what countries are doing. There's cultural context, and even when we provide medicines, the issue of acceptability is important, and other things. We need to understand our context. Governing context, again, is very important. Political context, like you see, the pharmaceutical area has a lot of political interest. Again, if you look at like the beta plan for economic development, it's already a lot of goodwill in terms of implementation of local manufacturing. There's a lot of political context that affects how issues come or how they are dropped. Economic context, again, very critical. Like remember when we were looking at the issues of local manufacturing, has changed a lot because of how the economy was affected by COVID. If you look at more countries globally, especially in Africa and other low and income countries, they are speaking about local manufacturing for sustainability, how that also affected a lot of issues. So we have to think through the context and to use it to your advantage, and we need to think through that even as now. The other thing we looked at were types of policies, public policies, and we said there could be distributive, redistributive, regulatory, or stabilization policies. For instance, if you look at the, let's say, redistributive, it talks about reallocating wealth, property, political or civil rights, or some other valuable item to the advantage of class-based groups, and it modifies the distribution of existing resources. So, and we were agreeing that not every policy is fit into a specific area directly. It may have other areas, but you can be able to place it somewhere. For example, now when we are looking at social health insurance, we have been contributing based on a fixed amount. And some of the people have been contributing, the lower kanda in the society have been contributing up to 5%, while the more you hit the 100,000 income mark, you start contributing 1 point something, 0 point something. By the time you are earning $1 million, you are contributing 0.0 something. But the person who is earning 20 shillings, 20,000 and contributing 500 could be contributing 5%. And that shift, the way it has come to bring the percentage, it now is kind of start redistributing and bringing equity. I don't know whether that fits in very well, but I'm just trying to bring in an aspect to try and explain. But when you read the policy, NPP, perhaps it's more lines towards distributive, but we can read more and agree because these lines will be shared with you. But most importantly, it's already in the policy, like I said. The other aspect is features of good public policies. You may not be able to go through all of them. Forward-looking, outward-looking, evidence-informed, inclusive, cross-cutting, gives lessons to learn, elastic and flexible. It must be very flexible to withstand the changes. The policies are meant for over a long period of time. It must be innovative and creative, must be known and visible, and can be monitored and evaluated. We saw that in the previous policy, we were not able to bring in a monitoring plan. The other aspect we saw is the history of public policy environment for the pharmaceutical industry. And this is going to be my last slide, because the other slide now delve into the issues in the policy. And we saw that the Kenya National Pharmaceutical Policy was developed collaboratively between the government, the pharmaceutical industry, and health professionals and consumers. And I believe even now this is the approach we are going to take. The policy succeeded the Kenya National Drug Policy of 1994, which was exactly 18 years after. Perhaps because today is 12 years, is it 10 years since actually it's 12 years since the other policy was done, the NPP. I don't know how long it will take. And then I hope it don't take another 6 years and it becomes 18 years like the other one. The other thing we noted is that the overall goal of KNPP is universal access to quality, essential HPT, medicines and essential technologies for Kenya. And it provided a framework for comprehensive reform and revitalization of the pharmaceutical sector in a manner consistent with the national health and development goals. So when you look at that process of public policy making, you'll be able to see what we are about to go through. It's not an easy process. It has a lot of to and fro, but I believe that as we engage together and we keep working together and we submit very well issues that have been supported very well by evidence, like we're talking about the root causes and the really impactful solutions and showing how the theory of change will happen. There are some areas of our problems that have been really pressing us in the past that we may be able to change by winning the leadership and the political class that really will be passing this policy. I think, Munyakin, if I reach there, I would have done justice to the policy making process.
Yes, I think that's now very clear. Thanks for that, Daktari. So there were a couple of questions here, but I think Dr. Susan has responded to some of them. It was just mainly on if there are any other HPT related policies that can be compared to this one as they give their submissions. So maybe just if you have a
Eunice,
comment.
Susan, would you like to answer that one?
Yeah, so actually I've attempted answering it, but because one, we have to start with the problems that are in our context, and then maybe ask ourselves, do we have a country that maybe had that problem and would like to benchmark with them? So I may not have an answer and say it is this country. It depends with what is the problem and where do we want to go, or do we know another country that had that problem and they solved it and now they're okay. So I would say it is more when proposing solution, there's a lot of searching for evidence, and that's why we're asking also for that evidence. So we may not have a policy to give you, but depending on the problem that you identify, please try as much as possible to search for evidence because you'll also propose a solution. So we don't have a particular answer for that because we don't know what problem that you'll come up with, you will identify. Thank you.
All right, thank you. Thank you so much, Dr. Susan, for that. So I see we've covered all the questions. And for those who had requested for the KNPP policy, we've just shared it on the chat. And also the evaluation report that was done. So all that is going to be shared on your emails once again, and also on the WhatsApp platform. So any other question that we have? So Dr. Susan and Dr. Nancy, I'm not seeing any other question coming in.
Okay.
But I'm assuming if any question comes up, our members will definitely reach out to the email that you had provided on the Google form, where they'll be submitting their feedback.
Okay.
And also, if anything comes to any of the PSK platforms, we'll definitely also share it with you so that you can give your feedback.
Okay.
So maybe at this point, I'd like to welcome all of you to just give a parting shot.
Okay.
So maybe who can start us off?
Thank you, Ezron. I know we have members of DHPT who are in. First, we
Yeah.
can give them a chance.
Sure.
Even as I and Susan say something.
Okay. So maybe they
Yeah.
can start, then you'll be closing with a parting shot.
Anyone in DHPT who has joined would like to say something? Dr. Eunice?
Good evening, everyone.
Good
I think
evening,
we just
Eunice.
appreciate the session today, and we look forward to receiving submissions from PSK members so that as we review the policy, we do it better than it was before. Thank you very much. And thank you, PSK, also for giving us a platform to be able to do this. Thank you.
Asante sana, Eunice. Anyone else from DHPT? Okay. I think, Susan, you can say something.
Yeah, so thank you very much, colleagues, for those who have been very consistent and maybe even for those who are attending the very first time. I think this is very important because submissions, we are encouraging you as much as possible, do submissions as organized groups, as an organization, as an individual, please, so that we shape the future. So please, based on the timeline that has been given for the 1 month, try as much as possible. Even if you submit one, for me, it is just encouraging all of us to do. And also allow me to also invite Dr. Nyingi, my director, to also say something before Nancy can wrap up.
Yeah, thanks, Dr. Susan. And I just want to echo your comments and really appreciate the insightful presentations we've had in the comments. Perhaps just to emphasize that policy making is a political process. I think it's important that we appreciate that. And the evaluation was just a pace setter in terms of identifying, the policy issues that may be imminent in opening up a policy development or a refreshment window. So I think it's an opportunity for all of us as members of the Pharmaceutical Society and KPA and interested members in the health sector to take advantage to really help in shaping the policy, in shaping the agenda So policy issues are the ones that will determine, whether or whether there is a genuine policy window, or whether there is urgency in refreshing the policy. And being a political process, mind you, then we also have to look at, be aware of what is happening within the governance and, and the political environment, the agenda of the priority agenda of the government, the emerging issues within the health sector, including even those, that are very current around, the financing and the like. So I would wish to call upon everybody to just pay attention and appreciate that we have an opportunity to really shape, what the pharmaceutical policy, whether it will be the medicines policy, whether it will be the policy around technologies will look like in the future. So please, give it the best attention as possible. And I do appreciate that, just like in everything else in the society, it's a political process that will determine, a lot of the decisions of the future. Thanks. And over to you, Dr. Nancy.
Asante sana, Dr. Nyingi. I think for me, again, without repeating what members have said, the issue of submissions is really very critical for us, and we are really calling on all members. Pharmacists are very key stakeholders in this process. We are the custodians of the policy in terms of being the ones custodians of medicines. And it's an interesting period in time, like just as I was mentioning in terms of context. In a period, there's a policy direction to bring all HPT together. So we really need to engage in this process. We are very glad that you joined us. Some have been with us since session 1 through 2 and now today. And we are grateful that you have taken a lot of interest and commitment to come this far. We pray that the request that final section of submitting, that you also take it seriously. The other thing is to appreciate and really give our assurance, because now DHPT is a fully fledged directorate. There's a lot of work going on in terms of the governance and authority being given. We look forward to even implementing future policies better. And just to give you a snapshot, when the DHPT, the Division of Health Products and Technologies, was created in 2019, you saw the first inaugural strategy, which has actually majority of the work and achievements that have been done in relation to the policy were done between 2020 and 2022. Interestingly, you will see less of 2013, 14, 15, 16. You're not seeing a lot of achievement, a lot of, other than the KEMSA that happened in 2013 and a few things. That shows how strong governance can impact. And so we are ready to review this policy. We hope to review it in the shortest time possible and do our technical bit and forward it to the leadership for approval. And so we will have timelines. We request you to be within them. And when we compile and bring together all the issues that we have collated, because we are going to so many other stakeholders, but we are so glad we began with the PSK and we have been able to complete. We'll bring them back to ourselves, and we'll be able to see again how it shapes. So thank you, everybody. We are happy, and we are really waiting for your submissions. Asante, and back to you, Munyakin.
All right, thank you so much, Dr. Nancy. So I think this is where we'll be closing the session, and I'd like to just say an appreciation to the team, DHPT team, Dr. Nancy, Dr. Tom, Dr. Eunice, the entire team. Thank you so much, and for the Africa Resource Center team for supporting this activity. Thank you so much, Dr. Susan, Dr. Nyingi. We really appreciate. So on our end, we'll be circulating the form with our members, and also the document that we had also shared previously. So for our members, I'd like to request you to just take some time, go through the document if you haven't, and share your feedback as soon as possible before the end of the deadline, which is in a month's time. So I think we'll now just go through the usual bit before we end. And the first one is to remind you again, if you've not, kindly subscribe to the events, the 3 events. Remember, the sooner you subscribe to these events, the sooner we are able to share the CPD points with you. Then a reminder for some upcoming activities. Remember, we are still on the World Pharmacist Day, World Pharmacist Week period. We'll be having the Family Fun Day, which will be happening on Sunday. And we have a couple of activities that will be happening. So you're welcome to come attend, come with your families, come with your friends. It will be an activity starting at 8 a.m. to 7 p.m. at Sikh Union, Wangari Maathai Road in Parklands. Then for our members in Lower Eastern Branch, there's an upcoming activity. I believe you're all aware, and for maybe those who are around the region, you can also attend. They'll be having a CME on pain management, and it will be happening at Voter Ranch in Machakos. And for the members from PSK South Rift branch, I believe you've already been informed that there's an symposium that is coming up on 5th of October, which will be happening at Famous Gate Hotel in Bomet. So you're very much welcome to attend, and ensure that you RSVP early with the contacts that have been provided in the posters. So that's all from our end, from the announcements. Once again, thank you so much, DHPT team, Dr. Nancy, Dr. Eunice, Dr. Tom, and Dr. Susan and Dr. Nyingi from ARC. We really appreciate and looking forward to more collaborations in the future. Asante sana, and thank you all for joining this session. Have a good evening.
You too. Thank you very much.